Om Swastiastu. Greetings to facilitator and evaluator. We are from small group discussion B3, and in this opportunity, we will present our student project with title Hajj Travel. Okay, and these are our group members that participated in the student project presentation. Okay, let's start the first chapter introduction.
Hello, my name is Anggi Devi with last three digit of student ID number R088. I will explain about the introduction of Hajj Travel. Hajj is a yearly pilgrimage to the Makkah located in Saudi Arabia for Muslim people. Through Hajj and Umrah, visitors from almost every country come to Saudi Arabia. Around 3 million Muslims from more than 180 countries come to Makkah. However, around 63 until 67% among these Hajj pilgrims are geriatrics who have metabolic or chronic disease. The risk of communicable disease and Hajj session has been correlated for almost 1,400 years. The most common disease is respiratory infection because of the mass gathering, physical isolation, and extreme heat that occur. Other common health issues during these events are cardiovascular disease, trauma risk, and environmental heat injury. Pre-travel consultation plays an important role in improving Hajj traveler awareness to disease risk and in compliance with preventive measures. Post-travel evaluation is also important to prevent the spread of disease that these travelers get during Hajj session. However, there were many travelers who didn't follow the health regulation and were still forced to go to Saudi Arabia. With the important role of pre-travel consultation and post-travel evaluation to prevent potential health issues during Hajj travel, further explanation is needed regarding Hajj travel. Okay, that's all from me. Thank you.
Hello, my name is Sophie Acchariya Paramittha with my last three-digit ID number 156, and I will be delivering the problem formulation, purpose, and the benefit of the student project. According to the problem identification that has been presented through the background of the student project, the problems conferred can be formulated as shown on the screen. Meanwhile, the objectives of this student project is to answer what's in the problem formulation. Lastly, the benefits of writing the student project is to enhance the understanding and knowledge about Hajj travel. These contents intend to amplify the understanding of the definition, data, pre-travel consultation, potential health issues, and post-travel evaluation of Hajj travel. Maybe that is all from me. The next part will be delivered by the others. Thank you.
Okay, my name is Ananda Raharja with last three digit of student ID number is 136, and I will start the chapter 2, the discussion about definition of Hajj travel. Okay, according to Islam, Hajj is a journey to the holy city of Mecca in Saudi Arabia, which every adult Muslim must perform at least once in a lifetime. The pilgrimage rite begins on the 7th day and ends on the 12th day of the last month of the Islamic year. Activities carried out by pilgrims during Hajj are number 1 is ihram or have the intention to perform Hajj. Number 2 is tawaf or walking around the Kaaba 7 times counterclockwise. Number 3 is sa'i or walk 7 times between the hills of Safa and Marwa. Number 4 is wukuf or ask forgiveness from God. Number 5 is jamarat or throwing pebbles. And the last one is tahallul or haircut. Okay, that's all about the definition of Hajj travel. The next slide will be continued by my friend. Thank you.
Hello, good morning, good afternoon, and good evening, doctor. My name is Putri Yudhistira with three last digit student ID number is 098. Okay, so annually, there is around 3 million people from around the world, from many countries, that perform pilgrimage in Saudi Arabia. And it is known that each country had quota to send their pilgrims, about 1 to 1,000 of their citizens who are Muslim. And here is the data from 2015, where Indonesian on the first place with 168,000 pilgrims, followed by Pakistan, and then India, Bangladesh, Nigeria, and Egypt. The next slide will be continued by my friends. Thank you.
My name is Angelique Cynthia Caroline, and the last 4 digits of my student ID number is 068. Now I would like to continue about the data of Hajj Travel. Most of the countries that send their congregations are developing countries with various infectious and endemic diseases. The types of diseases that are the main problems in the Hajj include respiratory tract infections such as influenza, meningococcal disease, tuberculosis, hepatitis A, B, and C that can now be prevented. One of them is through vaccination.
Okay, hello everyone. My name is Evangelina Vincent Lacerda with last 3 digits student ID number 170. On this occasion, I will going to continue explain about the pre-travel consultation for Hajj Travel. The effective of pre-travel consultation, of course, required attention and medical assessment of the patient by paying attention to the background for Haji pilgrimism, such as the first one is past medical history that consists of age, medication, patient medication, underlying condition, and all allergy. And the second one is special conditions such as pregnant, menstruation, older age, recent surgery, and terminal illness. And the most important thing is immunization history that they must do meningococcal vaccine and other vaccinations such as seasonal influenza vaccine, hepatitis A vaccine, and hepatitis B vaccine. And the last thing is prior travel consists of experience, travel duration, and activity. The pre-travel consultation used to anticipate risks associated with the journey for Hajj travel. Well, that's all for me. The next point will be explained further by my friend. Thank you.
Hello, my name is Ketut Adelia Febrianti Puspa Dewi, with the last 3 digits of my student ID number is 041. So we will talk about potential health issue during Hajj travel. So the first one, we will talk about common disease. Based on previous research, the most frequently reported complaints among Hajj pilgrims were infection of the respiratory tract, such as influenza, meningococcal disease, tuberculosis, hepatitis A, B, and C. That's all from me. Thank you.
Hello, my name is Dewa Fony Prema Shanti, and the last digit of my student ID number is 004. So today I would like to explain about clinical manifestation of Hajj travel disease. First is influenza. It appears quickly after the virus enters the body with some complaints, and the complaints are ache, dry cough, headache, sore throat, loss of appetite, body chill, and sweating. Second is meningococcal disease. Sign and symptom of meningitis to watch out for include fever and chills, stiff neck, change in mental conditions such as frequent confusion, severe headache, nausea and vomiting, seizures, or frequent fainting, sensitivity to light, skin rash. However, the symptoms of bacterial meningitis are usually more severe and can lead to serious complications such as brain damage, hearing loss, and difficulty focusing. Third is tuberculosis. Cough that lasts for a long time, clogging of blood, more symptom at night, weighing loss, fever, weakness, chest pain when breathing, and no appetite. Hepatitis A, fatigue, nausea, and vomiting, upper right abdominal pain, diarrhea, yellowing of the skin and white of the eyes, loss of appetite, dark urine, fever, joint pain. Next. Hepatitis B, abdominal pain, especially in the upper right, bone and muscle pain, vaginal discharge. And then hepatitis C, fever, decreased appetite, dark urine, abdominal pain, joint pain, and jaundice. Okay, that's all about my presentation. Thank you.
For the chance, my name is Trifena Lisanias, and the last 3 digits of my student ID number is 119. Today I will discuss about the management of the common diseases that frequently happen in Hajj pilgrims. The first one is influenza. Antiviral therapy can be given to those who meet the criteria to cure influenza. Next, parenteral antibiotics may be administered within 1 hour of the introduction of IND to reduce circulating toxin levels to prevent complications such as septic shock and increased ICP for meningococcal disease. Next is isoniazid. is the main drug in the treatment of latent TB infection. The last one is hepatitis, which the management is highly dependent on clinical presentation, which will not be discussed right now. That's from me. The presentation will be continued by my friend. Thank you.
Okay, greetings. My name is Felix Ivan Robert Johnson Lubis. Now I'm going to explain about the prevention of Hajj travel disease. The first one is influenza. So the prevention is just adjustment of travel behavior through pre-trip advice. And then we have to avoid contacts with patients with respiratory illness, contact with birds and their droppings, contact with and consumption of undercooked poultry products. And the second one is meningococcal disease, simply vaccination. The third one is tuberculosis, simply using basal atau BCG vaccine. The fourth one is hepatitis. We can sanitate major plays a crucial role in preventing HIV infection, especially in food service industry. So that's all from me. Thank you.
My name is Bagus Satia Bayu Saputra, and I will continue the presentation. So in post-travel evaluation for Hajj Travel, so the WHO or World Health Organization recommend that certain travelers are advised to have a medical examination or return based on the risks undertaken during their travel. So screening can include several reasons, including reason for travel, destination choice, duration of travel, travel-related activities, personal, occupational, and social history. So examination is needed for traveler with symptoms below, such as suffering from a chronic disease, receiving treatment for malaria while traveling, may have been exposed to a serious infection disease while traveling, have spent more than 3 months in a developing country, having fever, persistent diarrhea, vomiting, jaundice, urinary disorder, or skin disease or genital infection.
All right, thank you for the time given. Now we've gone to the last chapter of this presentation, which is conclusion. Based on the explanation that's been presented, it can be concluded that Hajj is a pilgrimage or journey to the holy city of Mecca in Saudi Arabia, which every adult Muslim must perform at least once in a lifetime and is an obligation for Muslims who are physically and financially able. 2. Every year there are about 3 million people from various countries in the world who perform their pilgrimage in Saudi Arabia. Based on the number of residents who are Muslim, each country is given a quota, sending congregations of 1 to 1,000. There are several things that must be carried out and considered in pre-travel consultation for Hajj travel before departure, namely past medical history in the form of sex, age, medication, underlying conditions, and allergies. Based on the previous research, the most frequently reported complaints amongst Hajj pilgrims were infections of the respiratory tract, such as influenza, meningococcal disease, and tuberculosis, and then hepatitis A, B, and C. And the World Health Organization, or WHO, recommends that certain travelers are advised to have a medical examination on return based on the risk undertaken during travel. Next part is the suggestion. Hajj is a yearly pilgrimage to the Mecca located in Saudi Arabia, which is an Islamic holy city. This event hosts mass migrations every year, so the risk of communicable disease are possible due to mass gathering. So physical exhaustion and extreme heat that occur as well. Thus, pre-travel consultation and post-travel evaluation are needed to prevent the unwanted health issues during traveling. Here are the list of references that are used in the making of this presentation. Thus concludes our presentation for this evening. Thank you so much for your participation, and we'll see you in the next student project from Small Group Discussion B3. Bye-bye.